My name's Ina Farrelly. I'm the podiatrist with the Accelerate Wound Care team. When I first joined the team 15 years ago, one of the first things I noticed about almost every single patient that walked into the waiting room was they had gait issues. These patients had developed joint malalignment and calf muscle atrophy. So we started to look into research. Was there existing research related to gait and wounds? And we found that actually there's quite a large body of research that supports the fact that one of the key indicators of whether a leg ulcer is going to heal or not is their ankle range of motion. Now from this position, it should be able to move about another 10 to 14 degrees up in that direction. Feel for the head of the fibula, along the fifth met, and we'll try and get you to 90. Okay, and we're getting to 10 just barely with quite a lot of force on there. What you'd hope to see is 10 to 14 degrees of movement that direction and up to 50 degrees pointing down. We have Rosie here, and she has a lovely healthy leg with normal range of ankle motion, so that we know that she can walk normally. There's a lot of dorsiflexion there. Bring down, point again. Both of those movements, especially plantar flexion, require good calf muscles. So what happens is you've got your venous system or your veins and your lymphatic system that run up between the layers of those muscles. So when they contract, they're a bit like a corset squeezing those vessels to push the fluid up out of your leg. If the ankle is rigid, the muscle can't contract properly across it, so you'll start to see muscle atrophy. You'll very classically see these very skinny legs where there is no muscle definition because these muscles aren't getting a chance to work. The thing about walking is that we learn it in infancy. We don't think about it, we just do it. So often if changes occur, we're not particularly aware of them if they're quite small changes. But those small changes are really important. If you think of something like square dancing, if one dancer gets out of step or out of place, it has a huge impact on everybody else dancing with them. And that's what can happen with changes in gait. Now, we know that pain will cause you to change the way you walk. If you stub your toe, you will walk differently. The difference between a stubbed toe and an ulcer is that an ulcer is much more chronic. It's a long-term situation. So those changes to try and get away from that pain so it doesn't hurt so much become much more physically entrenched in the leg. And they become not something you choose to do, but something that you're unable to change. With his other good leg, he can't actually make such a long swing through with that because the limitation on the affected leg acts as a brake. So as his body's moving forward, it literally comes up against an ankle that's rigid and it just stops. Because you change the way you walk, you can change the way your limb functions and actually the shape of that limb. So people may start to invert or evert their foot in order to move away from the pain. And this leads to more fixed deformities developing. If we were to run our finger down his tibia bone, what would happen, because it's pointing out this way, you end up with a line of force almost outside of the foot, and that makes it a very inefficient mechanical part of your body. So what you're doing is changing the alignment of the joints in the foot so they no longer function efficiently, and potentially you're going to increase the wear and tear on these joints as well. You may see edema developing in the foot because the body's natural means of getting rid of swelling or fluid out of the foot is muscle contraction. And walking is a little bit like a symphony. We're expecting those muscles contracting at a certain point in gait. And if that doesn't happen, you'll tend to see localized edema in the foot. And this is a particularly problematic area if, for example, you develop an ulcer, as this gentleman has. It's just not very good at healing. So you can see where biomechanical changes in the way we walk because of pain due to wounds actually has quite a large impact generally on how someone functions, how they feel, how they can live their life, and whether their wounds will heal or not.